during the COMy 2021 Congress, we have co-chaired a session with Professor Mohti on the treatment of elderly multiple myeloma. And this included an expert panel of the Congress co-chair, Professor Thierry Facon, Marie Mateus, Professor Larocco, and Sonia Swigman. And the session, I think, gave the audience very clear messages. First of all, elderly myeloma is the most frequent myeloma subgroup, and frailty is the major obstacle against success of treatment. On the first day of the COMy, and there was another very great session led by expert faculty members, Keith Stewart, Gordon Cook, Garrett Morgan, and Hervé Avak-Lossois. And they shared the concept that elderly myeloma harbors more good risk features compared to younger patients because the disease evolves more slowly, so it's not an aggressive disease. And due to this nature, for instance, bone involvement is much less compared to younger patients. So it could be regarded as the younger patients have less bone disease, but elderly myeloma patients have more bone disease because the disease evolves slowly. But on the other hand, despite the less aggressive nature, we have the frailty issue and the comorbidities, which is the obstacle against the treatment adherence, and resulting with this, Thierry Facon presented in the beginning of his presentation, there's a abrupt, steep drop in the number of patients who are able to continue with further lines of therapy. And also the highest mortality rate is observed during the first days and weeks of the treatment after the initiation of treatment. So we have to enforce all our best tools and drugs combinations for the beginning and not sparing the best modality to the later phases of treatment. And we have now the frailty score, which has been addressed by the faculty members. It's been validated, and it's now an international myeloma working group guideline reference. And it might be considered a troublesome approach, but just one feature, being age 75 and above, gives you a score of 2, which is the threshold for being frail. And so other parameters are described in detail, and this tool has to be adapted to our daily life. So recent trials are now integrating frailty, and new trials are focusing on either elderly fit patients about the age of 65, or also targeting the frail population. So once we are talking about elderly myeloma, we have to, first of all, recognize the patient population. And during this session on elderly myeloma, the armamentarium had discussed, starting with the IMiDs, discussed by Facon, and I think he deserves this position more than us because he was one of the leaders in this field on MPT, methylprednisolone and thalidomide. And later his first study was able to show the effect of RD regimen and to be a much better approach than MPT. And later, last year, he presented the DARA-RD results, which is published and which is also well perceived by many. And finally, during the last ASH meeting, he also presented the ixazomib-RD combination. So on the backbone of RD or an IMiD plus the steroid, we can add either a monoclonal antibody or combine with a proteasome inhibitor, an oral one, which simplifies treatment approach for elderly patients. So among all these, RD seems to be the most efficacy reaching one. And according to the PI, Thierry Facon, he's presented during this COMy meeting that they are estimating a median PFS around 55 months. I mean, it or not, this is so long. And for the DARA-RD arm, and this one is much, much better than the transplant eligible protocols, which are excluding monoclonal antibodies. And on the other hand, the tourmaline-2 study was discussed in detail, and the combination of or adding ixazomib on RD was not able to give a much significant improvement in median PFS. Nevertheless, the median PFS of 35 months is not a bad number after all. And during the COVID-19 era, I think this is a major advantage of being an oral regimen and not requiring frequent hospital visits.